Hello and welcome to a second season of Her Voice. I'm Dina Faiz and today I will be discussing women and plastic surgery with a particular look at the demand for plastic surgery and how it's increasing globally, especially in the Middle East. There has been a noticeable rise in the demand for cosmetic surgery in the Middle East as more and more women succumb to the bombarding conceptions of beauty and perfection propagated by mass media. Cosmetic surgery has become a trend in many parts of the world and the Middle East because it has become socially acceptable to go under the knife for aesthetic reasons, and that people have assigned greater importance to the notions of beauty despite it being considered sinful in certain religions to alter oneself in order to beautify or enhance certain features for vanity purposes. In today's show, we will be asking the experts why so many women choose to have surgery. Are women in the Middle East more obsessed about it than their counterparts in the West? Isn't there a conflictual relation between covering the beauty by wearing the hijab and excessive addiction to facial and body plastic surgery in the Gulf region mainly? These and many more questions will be asked in today's show of Her Voice. But before we get into our discussion, let's have a look at this brief report on plastic surgery in the Middle East.
We are constantly surrounded by messages showing us how to better ourselves. From cosmetic products promising to give us more pouty lips, to cosmetic procedures pledging to give us our dream body. Cosmetic surgery has become increasingly popular in the Middle Eastern community, with Lebanon's capital Beirut seen as a supermarket of plastic surgeries. The country has one of the highest rates of procedures in the world. According to the Lebanese Society of Plastic, Reconstructive and Aesthetic Surgery, 1.5 million plastic surgeries are performed in Lebanon each year. But the Lebanese are not the only ones. Dr. Aham Ayoubi is a popular cosmetic surgeon in London who says nearly half his patients are of Middle Eastern origin from a variety of countries.
Arabic patients count for about 40% of my patients. United Arab Emirates is the most popular country where they come from, followed by Qatar and Saudi Arabia. There are a lot of lovely Kuwaitis patients coming, and I used to see a lot actually from Egypt, Lebanon and Syria, but not recently for the last year or so, sadly, as you know.
According to a survey conducted across 10 Middle Eastern countries by a leading beauty corporation, 37% of girls between the ages of 15 and 17 would consider cosmetic surgery. 63% of Arab women feel threatened by beauty ideals portrayed in the media, and 9 out of 10 females are unhappy with their physical appearance.
There are a lot of patients who want a huge number of plastic surgery to change their appearance, and I've seen a lot of patients who come to me and show me photos of Haifa Wahabi or Nancy Ajram or whoever, one of these Arabic celebrities, and I tell them that, listen, you are beautiful the way you are, but we can achieve some beautiful natural results which will make you look fresher, so you don't need to look like someone else.
But is the media's portrayal of ideal beauty the reason for the surge in plastic surgeries? Or is it merely the innate love for looking our best which has driven a rise in plastic surgery?
Beauty is in the eyes of the beholder, but in today's world, this famous phrase clashes with the widespread of social media and glossy imagery of beautiful, skinny celebrities bombarding our magazines, television and the internet. Some women choose to compete in a culture where youthful beauty is beamed at us as the most desirable thing there is. Images of beautiful women looking like Barbie dolls have swept the minds of women of all ages and cultures. Going under the knife to undergo plastic surgery has become a secret trend that in some parts of the world is forbidden to talk about, especially in the Middle East, where the women there are living a double standard life by hiding their beauty due to religious reasons, by wearing in particular the hijab, and sometimes even the burqa, and at the time prioritizing their undercovered beauty by choosing to transform their body image to the extreme. To discuss more about this subject, I have with me in the studio Dr. Pari Naz Mohanna, Consultant Plastic and Reconstructive Surgery from London. Thank you very much for joining us today.
Thank you for having me.
Dr. Pari, I just wanted to ask you, how would you actually describe the current fascination of women in the Middle East with plastic surgery?
Well, certainly it's on the increase. If we look at the trends, there's been an extrapolation in the number of patients, female patients seeking plastic surgery or even non-surgical rejuvenation. There's a lot of factors which are involved with this. First of all, it's the availability and it's the acceptance of plastic surgery. Maybe 30, 40 years ago, it was quite a taboo subject. People didn't talk about it. There wasn't much in the media about it. And therefore, because it felt like a taboo subject, less people were seeking plastic or surgery or non-reconstructive surgery. Nowadays, every magazine that you open, every television program that you watch, there's kind of an innuendo link to plastic surgery, be either direct or subliminal messaging. And as a result, women are quite receptive to this, some more than others, depending on how they perceive themselves. And obviously we know generally Middle Eastern countries are wealthy countries, and then if you're susceptible and you have the financial resources, then obviously it's an avenue that these ladies will seek.
Right. Cosmetic surgery is actually on a steep rise globally.
That's right.
Amongst women as well as men, obviously, as
yes.
you know, as a surgeon yourself. And I believe that it will bring more opportunities in both the work and personal relationship department. Do you think that is true? That is the case?
I don't think that plastic surgery dictates how one kind of perceives their relationships or one is in the workplace. There's many individuals who've never had plastic surgery, who are very confident in the way they look, and you started off by saying beauty is in the eye of the beholder. I would say that beauty is in the eye of the individual. So I have lots of patients that come to me and they want to have X, Y, and Z done, and it's very important, even if I sit there and tell them you don't need it or you need this, it's the way they perceive themselves. And it's very important that individuals, when they come for plastic surgery, have a kind of an attainable goal or objective. We just heard earlier in the VT that individuals come with pictures of celebrities wanting to look like an individual. And it's, I think, the responsibility of the surgeon to direct these people. They're very vulnerable often, and I think some individuals may, maximize on that, thinking just of making money, but I think generally, if you direct them as a, responsible surgeon, then they will hopefully achieve what they want to achieve without disappointment.
Right, okay. Well, Dr. Perry, if you can stay with us today, because what happened is that I actually met earlier with Mr. Mansoud. He's a consultant cosmetic hand and reconstructive surgeon. He's based in Essex, and this is what he had to actually say about how important is plastic surgery to women in the UK and many parts of the world. And are women happier about how they feel about themselves, and how does what type of procedures do they actually sort of opt out to and choose to do? So let's just watch this video together and listen to Mr. Mansoud.
The word plastikos comes from the Greek, which means to mold, and therefore plastic surgery is basically a question of molding tissues. And there are different aspects of plastic surgery where we do this. We have reconstructive surgery, we have surgery for trauma, we have surgery for congenital abnormalities. But we also do a lot of work in terms of molding tissue for cosmetic surgery. And it's for all parts of the body and for all kinds of tissues. People's perceptions of themselves have changed over a period of time. The way we live, the things that we do in our jobs have changed. For example, in this country, we are no longer a manufacturing economy. We are a lot more involved in the media, we are a lot more involved in interpersonal relationships. People are actually needing to be on show. They have to speak publicly, they have to actually impress people with the manner in which they conduct themselves. And if they have what they perceive as physical imperfections, they want to get rid of them because it holds them back in terms of their confidence and their ability to do things. What they see in magazines, on the web, and in other media makes a huge difference. And in fact, in the last 10 or 15 years, it's been a revolution. Not always for the best, because there are many instances in which people get obsessed with what they see as being a perfect image, and they want to achieve that for themselves, when actually it may not be physically possible to be like that. If your bone structure isn't the same, or your height isn't the same, or the width of your chest isn't the same, you may not be able to make yourself look like somebody whom you see on screen. So it can sometimes become an unhealthy obsession, but that's a very small percentage of patients. We're all different. We all have different ethnic backgrounds. We all have different types of skin. We all have different bony frameworks. And we have different social and cultural ideas of beauty. For example, people in Korea and in China, or Japan would consider eyelid surgery very favorably, because an open eyelid is considered a beautiful eyelid in those countries. In the West, the size of the breasts or the shape of the body or the presence of excess fat in some parts of the body may be considered a hindrance, and they may want to have something changed. So it depends. It's a cultural perception. It's a social perception as well. There are professional reasons. You know, we all think about Middle Eastern women as being conservative, and yes, they might well dress conservatively, but there is a huge middle class now of people who are well educated, who work, who are independent, and who are beginning to earn their own money. They have a perception of themselves which may be very different from what everybody else thinks, and just because somebody tends to cover them up and dress modestly doesn't mean that they don't feel strongly about the way they look and the way they feel about themselves. It's not necessarily about what you put on show for the rest of the world to see. It's what you see in the mirror, what you like about yourself or what you don't like. I see a lot of Middle Eastern women as being strong people, as being intelligent people, people who have an opinion, people who feel strongly about themselves, and who don't see themselves as any different from their Western counterparts simply because they belong to a particular group, either ethnically or by way of religion or whatever else. Women are women, and they feel the same about themselves regardless of where they come from. In my practice, very common procedures are for breasts, enlargements, reductions, uplifts. A lot of women see me for tummy tucks, liposuction for reshaping the body, rhinoplasties, and eyelids or blepharoplasties. And then of course when they get older, one of the things that comes into play is the sagging of facial skin, and then neck skin, jowls and so on and so forth, which need to be corrected. Another large segment of patients come to see me for facial rejuvenation without surgery. So I do a lot of patients who have either wrinkles which need to be treated with botulinum toxin or Botox, as you may have heard of in the press, or they have deep lines which will not go with Botox, and they'll have fillers put in to try and rejuvenate themselves, but without surgery or without an anesthetic. For the record, between 10 and 15% of patients who come to see me for plastic surgery, I advise them not to have an operation, because I think it's inappropriate. I think it's being done for the wrong reasons. Maybe there are health issues in the background. Maybe people haven't reached an end point in terms of their weight loss, because we like to wait for at least 12 to 18 months for a patient to be completely stable before we actually think in terms of doing surgery. And sometimes, it just isn't the right thing. It's not, if somebody has unrealistic expectations. If somebody brings me a picture from a magazine and says, I want my nose to look like this, and it's a little small snub nose which is turned up, and the person who brings the picture to me is 5'10", has got a good bone structure, a good chin, a good jawline and everything else, and they want a tiny little nose, well, that's going to lead to unhappiness. And I think it's far better for a surgeon to say up front in the beginning, I'm sorry, this is not something that you should have done. I think you'll be unhappy. You'll land up on a slippery slope, having multiple operations for secondary corrections, which will not give you the result that you want. Best not to do this.
So, Mr. Mansood is saying best not to do this. What do you think?
I agree. It's not a global best not to do it. I think it's very important that you have a thorough consultation. I think the first consultation with a patient is absolutely crucial, both from the patient's perspective to develop a rapport, understanding, and see if they trust the surgeon that they've gone to see, but more also, as importantly, for the doctor, for the surgeon, to see whether the patient's objectives are realistic. What is the motivation behind seeking plastic surgery? Is it psychological? Is it physical? Is it purely psychological? You have to identify patients, a small percentage, but there are individuals with body dysmorphic disorder who no amount of plastic surgery will satisfy them, because it's the way they perceive themselves in the mirror is in an unhealthy way, and therefore they will seek plastic surgery continually and just not reach their end goal. So I think as a surgeon we have a responsibility, and it's more difficult to say no, but I think it's very important to identify when to say no and when to direct the patient, to another route.
Yeah, well, I mean, it's interesting to actually hear your point of view about this, because now you're saying that it is more sort of psychologically related rather than actually sort of just wanting to have a beautiful body. But actually today we've also got joining us here in the studio is Mariam Rida, who's also Rad, yes, who's also sort of opted to carry sort of sort of doing plastic surgery for yourself as well, or you did some kind of plastic surgery for yourself, Mariam?
No, I never had any plastic surgery.
But you did the superficial, isn't it? The superficial type of surgery, yes. Okay. So can you actually give us an idea of why sort of you decided to do something like that? I mean, why did you actually go for, I heard it's Botox, isn't it?
Botox,
yeah,
yes.
Botox. So why did you choose to do something like that?
Basically, I mean, when you get to a certain age in your life, you go through a lot of changes, and, you know, sometimes you might feel a little bit, you know, that feel-good factor is not there anymore, and you want, you know, just boost your confidence and your, you know, feeling good. You would look around and see what kind of things you can use. I mean, Botox is something very light. It's not very intensive. It's not nothing too major. So when you have a little bit of fine lines coming and you think, you know, how can I get rid of this?
We all think that. At one point in our lives, yes.
Exactly. And then, you know, you think, why not? It doesn't cause any problem. It's not something major, and it makes you feel good about yourself and boosts your confidence. Yes. Something as little as that can cause a lot of good, I think it's good for anybody, but nothing too major or going through too much obsessive sort of behavior and obsessing over how you look. I don't consider that healthy, but, you know, little bits and pieces like rejuvenation and enhancing your beauty, I don't think it's anything bad.
But would you actually think of doing the more sort of invasive type of surgery yourself?
No, I would not. I would not for myself, but because I've seen a lot of people going through plastic surgery, and I think they are in danger of doing too much, and, you know, you do something and you think, oh my God, I look too good, and you start doing something else, and then it leads to something else, and then you become greedy, and before you know it, you're addicted to plastic surgery, and you don't even look good because too much plastic surgery.
Obviously, we've seen quite a few of the pictures in the report, showing us the different sort of, you know, things with the big lips and you know, the enhanced sort of lips in the face and the Botox, and it's very clear that they've done it.
They don't even look normal. They don't look natural. I mean, natural beauty is just enhancing your beauty. Having something like Botox or macrodermabrasion just to, you know, rejuvenate your skin, that's nothing you know, intensive or nothing bad. But going through intensive kind of surgery, I don't think it's healthy, to be honest.
Yes, no, I totally agree with you. Well, if you could just sort of obviously stay with us in the show, we will come back after this short break, but you know, please do join us for some more. Dr. Parry, thank you again for joining us, and Mariam. Just wanted to ask you a question. Now, one of the 9 countries that have a global reputation for plastic surgery is actually Iran, as it's known for the hub of plastic surgery. Why do women in Iran choose to do plastic surgery despite Iran's strict rules in how women sort of dress?
That's absolutely right. It is one of the big hubs of plastic surgery, particularly with respect to nose jobs or rhinoplasty. About 200,000 cases of rhinoplasty carried out in Iran, and if you look per capita compared to America, it's 7 times. So one might say, well, why do they seek, you know, such intense need for plastic surgery? You're quite right, the hijab, obviously since the revolution, has been compulsory dress code. And I think the women there feel that the only part of themselves which is on show as a result of the hijab is their face. Initially, in early parts of the revolution, we saw that once the stringency had dropped a bit, a lot of makeup was being worn by women. There was a less move towards plastic surgery. It was just very intensive makeup. Maybe in the Western world, it's maybe something we would see maybe at weddings or parties, etc. But this is, you know, day-to-day facial makeup to an excess, because the women wanted to showcase their beauty that they had, and that was what was on show, and therefore they wanted to maximize on it. But then we've seen over the last 20, 30 years, a great move towards non-surgical and surgical rejuvenation for women in Iran. And I think, again, that's to do with they regard their face as almost a piece of art that they want to maximize on. My only concern, I mean, I'm Iranian myself, so my only concern is that their concept of truly what is beauty is maybe somewhat misguided. I think they're strongly influenced by all sources of media. They look towards the Western world as the gold standard of beauty, and it's very common for young girls to go to the plastic surgeon there and request a Barbie doll style nose.
Yes,
so
it's
they
like
want
an open surgery,
It
isn't
is,
it? You know, you walk in and you walk out, and instantly you can have your nose done, you can have your lip enhanced, you can have all sorts of things done.
And it's not that I'm against surgery, and it's not that, you know, I'm a plastic surgeon myself, so I carry out a lot of these procedures, but I think it's very important that, as Mariam was saying earlier on, that it's about enhancing what one has. Whatever procedure is carried out has to be in harmony with the rest of the individual. There's no point having a Western nose on a Middle Eastern face. There's complete loss of harmony between the nose and the bone structure. And fine, the rhinoplasty is absolutely fine, but it's about refining what you have. And I think partly responsible is the individual, but I think of greater responsibility is the surgeon that carries out, because you can guide and say, look, this is not, I don't think this is not suitable for your face, etc. But unfortunately, not everyone has scruples. And one of the things in Iran is that on the register, there's about 170 surgeons who are registered to carry out cosmetic procedure. However, the number of individuals carrying out cosmetic procedure is near to 5,000 to 6,000.
And that's because they're not on the register,
They're not on the register, they're doing it on the black market, which results in a lot of, as we see on TV all the time, botched surgeries, individuals then seeking further and further plastic surgery, which almost then realms into the area of reconstructive surgery, trying to normalize the errors that have gone on. And unfortunately, these individuals then never are satisfied. Although we were talking about beauty is in the eye of the beholder, when I go to Iran on holiday or on medical trips, etc., and I see these women with Western noses, and I think, gosh, that just looks so wrong.
It's so wrong. It doesn't belong.
So many concepts. Back to Leonardo da Vinci and all his kind of measurements of what is the beautiful face. But then it's not about the eye of the beholder, because the person who's walking around is very satisfied. And the other thing, it's a big status symbol in Iran. Having plastic surgery and people knowing that you've had plastic surgery is a status symbol. It's acceptance in high society. And sadly, individuals who can't afford it, or maybe luckily they can't afford it, at least they've got their own noses, they walk around with plasters on their noses or white tape on the nose, pretending that they've had plastic surgery. So it just shows you the impact of kind of the social pressure on individuals.
I mean, going back to the subject of the rules of Islam as well, isn't there a contradiction between, obviously, the rules of Islam to cover excessive beauty while going to extreme measures to achieve the so-called doll face and body? Because, you know, having to cover and then trying to do all sorts to their body, isn't that a contradicting thing, do you think?
Well, I mean, in a way, I guess it is, but then again you could say wearing makeup is a contradiction, because they are enhancing the natural beauty that you have by wearing the lipstick, eyeliner, etc. That's a form of enhancement, isn't it? Dyeing your hair is a form of enhancement. I think it's a spectrum. For some people, just wearing the makeup is sufficient, and for others that's not enough, and they want to push the boundaries. And I think it's the fact that, as you said, it's about the hijab and the restriction in a communal place. They want to maximize on what they have. Maybe that's ironic, but as we were hearing earlier on, these women are still women. They still want to look beautiful. They are still influenced by media, and they are exposed maybe to more medial influences than we are. I've noticed that my Middle Eastern patients, the level of knowledge that they have about surgical and non-surgical rejuvenation is above and beyond any patient who's based in the United Kingdom. They're well read, they're very knowledgeable, they talk very openly amongst their girlfriends about what have you had, etc. And you know, they come to you very well armed with information. So it's not a whimsical thing, they come with a lot of knowledge, and you may feel, you know, one may feel that's a bit contradictory, but you know, that's the society today.
Right. Well, we would still like you to stay with us, Dr. Parry, because we will go to Dubai now. And we're going to meet Dr. Jafar Khan. He's a plastic surgeon in Aesthetics International Dubai, who will also give us a more clearer picture about the cosmetic surgery in the United Arab Emirates. So let's just watch it together.
Over the years, we've seen cosmetic surgery grow from 3 plastic surgeons when I first came to over 330 in Dubai. It was very interesting to read a CNN report stating that the highest number of per capita plastic surgeons in the world is actually in the United Arab Emirates. The percentage of patients that I've seen from the Middle East has changed quite dramatically since I came in 1998. When I first arrived, it was of the order of probably 5 to 10%, and now I think it's gone up between 35 and 40%. I think the most common procedure that I see amongst the Middle Eastern population here is probably rhinoplasty. This is followed by body contouring procedures such as abdominoplasty, liposuction, and then breast augmentation. Actually, surprisingly, in my patient group, very few people come with pictures. I think the only time really that they come with pictures is when they've got a magazine and they say, this is what I don't want to look like. So really I don't have that problem, and I'm also very, if you like, I'm pretty particular about patients, accepting patients who have unrealistic expectations. So having a picture to show you and illustrate to you something that they may like to be close to look like, or something that they would not like to look like, are very helpful in terms of guidance. But I think plastic surgery is all about managing expectations. Undoubtedly, the media play a very major role in what the general public conceive as available in plastic surgery, and indeed what is deliverable in plastic surgery. Sadly, that's not always the case. I think that responsible media is extremely important in promoting those things which are tried and tested, rather than everything that happens to be novel and new. I often tell my patients that everything that's new is not the best. In fact, we should probably wait a year or a year and a half to see the results and the outcomes of various new procedures or lasers or light sources, rather than to jump into them straight away and ask the question, what is new? I think one of the things to remember is that using a veil or a abaya to cover one's beauty to deter attention, as per the guidelines of our religion, is very different from doing cosmetic surgery or non-surgical rejuvenation to improve one's self-esteem and feel better about oneself. So the two things don't really necessarily tie in. The trend, as you mentioned, amongst the more wealthy segments of the population in the United Arab Emirates is really no different from what it is anywhere else in the world. If aesthetic surgery is affordable, and if it's safe, and if the indications are correct, then it's open to anybody who is interested in doing it and fulfills the parameters such that this becomes something useful in their life rather than a potential risk. If I find someone attractive, I'm not really looking to see whether it's natural beauty or cosmetically altered beauty. In the end, the art of plastic surgery is that we really shouldn't know the difference. The topic of medical tourism in the Middle East, and particularly in Dubai, is one that is asked quite a lot. It is also one that is being actively addressed by the authorities here, the DHA, Dubai Health Authority. And it is something that I think Dubai is perfectly poised for. Remember, when we first came here, Dubai had just the beginnings of growth. And over the period of time, it now has a lifestyle that attracts professionals from all over the world. Given the fact that it has great infrastructure, great connectivity in terms of airlines, tax-free, I think it has all the makings, a great geographical location as well in the crossroads of East and West, that it is perfectly poised to become the plastic surgery hub, if you like, for this region and eventually for the world. In many ways, I don't really like to call it medical tourism. It should really be coined as the International Society of Aesthetic Plastic Surgery has introduced the term medical procedures abroad. This gives it a slightly more serious note that you are having a medical procedure, and although you're choosing a different country to have it, it's still a medical procedure, so that all of the precautions that you would normally take at home in terms of your choice of hospital, your choice of doctor, should be taken when you're overseas.
Dr. Perry, what's your views about medical tourism in the Middle East, and especially in places like the United Arab Emirates, Lebanon, and obviously Iran, to do surgery there?
Well, there's a lot of medical tourism, as we've heard from Mr. Jafar Khan. It's on the increase, not just in the Middle East, a lot of the Eastern European countries, the South Asian countries. And one has to ask, why do patients seek the route of medical tourism? In the wealthy population, it'll be because they want to go to the best of the best, and therefore they've done extensive research and they know that a certain individual is an expert in a particular procedure, and therefore they're willing to pay to go to that individual. Unfortunately, in the majority of individuals, that's not the driving force. The driving force is they want plastic surgery, cosmetic surgery on the cheap. And particularly in a lot of the Eastern European countries, I mean, I'm not talking blankly,
Yes, yes.
Eastern European countries, South Asian countries, procedures are more affordable. For example, even in Iran, if you compare with the UK currency, rhinoplasty in Iran, the whole thing might cost £2,000. Here, rhinoplasty, surgical anaesthetic and hospital fee may be in the order of £8,000 to £9,000.
That's a big difference.
Therefore, there's a
isn't
big
it?
difference. So individuals may be driven to a country where they find it more affordable. But Mr. Jafar Khan made a very good point. It's still surgery. It still has potential for complications, and therefore, just because you're doing it in a nicer climate, you're staying in a hotel, it doesn't minimize on the gravity of what you've had done. My concern with medical tourism is because I compare it to the care that I give my patients. So my patients, I give them unlimited consultations before the surgery because I want them and I to be on the same hymn sheet with the same objectives for the surgery in order for there to be satisfaction all round. And also, more importantly, is the post-operative care, the aftercare. Okay, the patient will be in hospital, you'll see them, that's the same in both countries. They'll be discharged, they might have a 1-week follow-up, same in any country. However, the patient cannot indefinitely stay in the country that they've gone to have the surgery. Ultimately, they're going to have to come back to their own country. And complications can be immediate, early or late. The question is, once they come back and they've got the complication, who do they go to?
That's right, yes.
Their GP often doesn't know because the patients have had no correspondence from their surgeon to the GP, so the GP has no idea that the patient has had any cosmetic surgery, and often the patient doesn't want their GP to know. Secondly, they don't have a plastic surgeon here that they can go to because they seek surgery abroad, usually because it's cheaper. Thirdly, where do they go? So they go to the NHS, and I see in my NHS practice a lot of patients who come following surgery that has become complicated, either an infected breast implant, a cheek implant, it can be anything. Something's gone wrong and they either come to the National Health Service to have that rectified, or they come and see you privately at a greater cost to them. So I'm not against
double costs, isn't it?
It is a
Costs
double
over there
cost.
to have the surgery, and then the extra cost of having to deal with the
either
complications
for the
following
patient
that. Yes.
or to the National Health
That's right.
Service.
Oh yes, yes,
And
that's right.
for me, it's about wherever you go to have plastic surgery, be it at home on your doorstep or abroad, you cannot research it enough. You must make sure that the individual carrying out your surgery is board certified. You know, you can identify all of that. You have now access to internet. There's a wealth of information there. Make sure that they're board certified. Make sure that they're on the GMC register. Just very basic things that patients may not have knowledge about. It's often the individuals who aren't, who do a lot of marketing and they're in the glossy magazines, and your patients who are unaware of what it is that they should be seeking are quite dazzled by this.
Right.
Where he's in a glossy magazine, so it must be okay.
Right.
Or she's in a glossy magazine. And don't think non-surgical rejuvenation is without its complications.
Right.
You can also have lots of complications in that area, and one of the problems with non-surgical rejuvenation, particularly in the UK, never mind abroad, is it's very poorly policed.
Right.
And as long as the prescription is written by a doctor, anyone can inject Botox, a beautician, and some beauticians inject it fantastically, but I think it's very important that when you're seeking any form of intervention, non-surgical or surgical, that you do your homework. Just like if you're going to take your car to a mechanic, you do your homework beforehand. This is even more important.
Well, we've actually got with us right now Mrs. Nada Okati, who's actually a businesswoman and entrepreneur of Iraqi roots, who's living in London, and she's got a completely different view about plastic surgery. Thank you for joining us, Madame Nada.
Oh yes, hello. Hi.
Hello, how are you? You're right.
I'm fine, yes.
Madame Nada, what's your views about women that choose to have plastic surgery?
Well, in fact, I'm against it. People think plastic surgery will make them look better, when it's most cases it makes them look worse.
Oh yes, yes.
I think there is a lot of risk, you know. There is no such a thing as a surgery without a risk. So there's medical risk as they do in any surgical procedure.
Right. I mean, would you actually consider having it done yourself?
Not really, no.
I don't think you need it. You're very beautiful.
I think plastic surgery depends. If you go like a facelift,
yes.
I think now it's become an old fashion.
Right.
But there is other things, like most women goes for cosmetic surgery to get a flatter tummy or bigger breast or things. I don't need to do this, but they have to be very careful and choose the right surgeon and good references, and they have to search a lot about this.
Right. I mean, because you've got obviously images of beautiful women everywhere in the media, in magazines, is it not tempting to actually change yourself to a better image to benefit from the new scientific developments in plastic surgery that would allow you to look maybe, I don't know, 20, 30 years younger?
Yeah, well, there is other thing that non-surgical facelifts or other things, you know, happen lately. So it's worth to find out and try, really. Yeah, you know, that's. But we need to, you know, you need to be sure about what we are going to do. So for myself, there is other things for if you go for beauty. A lot of beautiful ladies is like they can use Botox, fillers, and now there is plasma, it's coming new, and there is sculptura, and there is other, they can achieve what they want, really, with no risk.
Yes, yes, that's absolutely right, yes. I mean, would you actually sort of consider maybe sort of if your daughter comes or somebody that you know from the members of your family who would actually say, well, I'd like to have plastic surgery, would you actually support them? Or maybe sort of go against it and tell them about the complications involved?
Yes, yes. You know, because now it's, if you go to the internet and you go and look for the cases, there is really, you have to be very careful and you have to warn them, yes. They have to look and they have to search. So I won't really recommend that at all.
That's wonderful. Well, thank you so much for giving us your time today and joining us. I've also got joining us over Skype, I've got Laura Turjman, who's an architect living in Essex and also from Syrian origins. Welcome, Laura. How are you, Laura? Are you with us?
Thank you. Yes, I'm my views are that I don't particularly agree with plastic surgery. I am very, you know, pro looking good and take very much, you know, care in my appearance and believe that women should enhance their beauty with makeup. Right. But I think plastic surgery is one step too far for me. I don't agree with it because I think it's addictive, and I think that you must learn to accept yourself. I mean, you get people like, you know, we've lost our Bridget Jones, Renee, Zoe. You know, she looks completely different. She can't do another movie now. You know, she didn't even. I think that if she'd known she was going to look like that, she would have not done that.
Right. Yes, I totally agree. Yes.
And I think there's a lot of pressure on women to look a certain way, but I think that confidence is from within and it's from yourself, and self-acceptance. It's not something that you go get a nose job and then you're going to suddenly feel a boost of confidence. I don't believe that.
Right.
And I think that I don't believe that also women necessarily wearing the hijab has got anything to do with them wanting more plastic surgery or less because they're covered up. I think that's again to do with self-acceptance. And if you accept yourself for who you are, then you embrace that, and then your confidence will come and ooze from within. It's nothing to do with you know, getting your breast enlarged. You know, I'm not all busty. I would never do it because I'm just happy with who I am, and I believe if a man is going to come into my life, he's going to accept me for who I am as well. And if he isn't, so so be it. I'll find somebody else. You've got to learn to love yourself, who you are, in order to other people to love you.
Yes, I mean you're a confident young lady, and obviously at this age, I think something like this, you wouldn't even contemplate the thought of it. But maybe 10, 20 years down the line, would you actually consider, after having children and sort of being married and when you're probably in your 50s or 60s?
I can't answer that because I don't know what I'll be like then, but yes. I can answer for myself now, that now I don't feel the necessity, it's not necessary for me to do something like that. And I think that there are other ways in which you can, I think that a lot of people, eat themselves to becoming sort of size 18 and then want a tummy tuck. Why do you let yourself loose in the first place?
Yes.
I wouldn't do that.
Right.
I think that, okay, a little bit of Botox, maybe I can sort of accept that if somebody wants to, get a few, make the lines, less visible, less laughter lines. I could sort of understand that. But for you, I think to sort of start with nose jobs, I mean, I've seen a girl who has had one done, and I do believe it sort of wasn't natural for her face, because the distance between her upper lip and her nose was then smaller, which then tampered with her top lip. So I think that they can get it wrong, and in Jordan, it is true about them walking around with a plaster, and it's sort of a sign of status. Yes, I can afford this sort of thing.
Yes,
it's like their Chanel bag over there and a nose job. Really, it's quite funny.
Yes. So would you choose the Chanel bag or the nose job?
Chanel bag away for me. Yeah, no, I'm happy with my nose, and I'm happy with how I look. And makeup is where it ends for me. I do have a lot of makeup, and I do experiment with makeup, but I know at the end of the night I can get my wipes out and wipe it all off, and it will be gone. So.
No, thank you ever so much, Laura. You are a beautiful young lady, and we really do appreciate you joining us in the show today. So, no, thank you so much.
Thank you. Thanks.
Thank you very much. What do you think, Dr. Perry? I mean, obviously, having heard this young lady explain herself and saying how she's, sort of the sort of girl that would oppose, and also Madame Nada Okati saying that also she opposes the fact that having surgery is wrong and it shouldn't happen, and maybe something fine, okay, but nothing too drastic. What do you think, Mariam?
Yes, I totally agree. I don't think it's necessary to go through something like that, too intensive, and change yourself completely for social acceptance. I mean, you have to be happy for yourself and how you look, and as our friend mentioned, it has to come from within. You have to be confident enough in yourself and accept yourself as you are. I don't think cosmetic surgery and going through too much change will change anything really for you. You can always obsess about something else and another part of your body, and you just can keep going and going. I totally agree, yes. Yes.
Well, stay with us, because now we have clips of people's views and opinions about plastic surgery. We also sort of asked men whether they preferred, believe it or not, women who had plastic surgery and who didn't. So let's just watch this VT together.
Now in Middle East, even in Tunisia, Morocco, doctors, they are very good and they are famous. So why not? Any woman in the world want to be beautiful. Yes, I did my nose. I did nose job. It's because it was a little bit bigger. So I said if I make it a little bit smaller, it will suit me. It will suit my face shape. So I did it. That's it. I went to the doctor and everything is fine. I'm very happy now.
No, I will not consider it. It's a torture. Because you're born with something, that's what God has given. Why should you change yourself with plastic surgery? It's not needed. That's my opinion.
For me, natural beauty is the best.
The main reason, because women are okay, men, they're not happy with their bodies or their faces or whatever. Okay, I would consider, but not now, maybe later. On my face or some...
Yeah.
Why not? But not now. Mostly women over 40 on their faces, yes. It's obvious, lifting and whatever, and the breast implants are pretty much obvious.
Back to you, Mariam. If you were a person who actually wears a hijab, how would you actually undergo plastic surgery?
Because of the hijab? No, I wouldn't. I mean, I personally don't think it's necessary. Hijab, although in some countries where women wear hijab, their face is the only part of their body that they can display and show. So I've seen a lot of people think because that's the only place, then obviously they can show more of their face, and then they keep enhancing. They do rhinoplasty or different kind of things done. But personally, I don't think it's necessary. I mean, of course, a little bit of makeup and things like that is nice. It enhances your beauty. But going through so much change, like cheek implants and lips implant and all sorts of things, I don't think it's necessary at all.
Right. Dr. Parry, what advice would you give to women that think of having plastic surgery in the Middle East?
Having it done in the Middle East, or Middle Eastern women wanting?
Middle Eastern women wanting to have surgery, plastic surgery.
My advice would be the same for anyone, man, woman, whichever nationality, culture, background, seeking plastic surgery, either in the form of surgical or non-surgical rejuvenation. I just want to add a little footnote here, because we heard earlier on Madame from Barcelona was very against interventional plastic surgery, but thought that non-surgical rejuvenation was acceptable because it had no risk. I just feel obligated to say any form of intervention carries a risk, and don't just seek non-surgical intervention because you think there aren't going to be any complications. If anyone tells you that you're going to undertake some form of procedure, be it non-surgical and surgical, and there's no complications associated, run out of that consultation because they're not being honest to you. So I just wanted to mention that.
Yes,
okay.
no, that's very important,
and so then my advice would be, therefore, one, really do research to identify your plastic surgeon. Go and have more than one consultation with different surgeons. See which one you develop a good rapport with. This is once you've identified that they're qualified, they're on the register, they're board certified, and they are specialists in the area that they're saying that they're specialists in. See if they've got any websites, if they've got any testimonials. Do you know anyone that's been, a recommendation is the best form of publicity. Exactly. And, you would always go for recommendation for other things to do with your car or your plumbing, etc. What more important than, your health and your body, etc. Go to your plastic surgeon, have the consultation. Make sure you have more than one consultation. You can only absorb about 30 to 40% of what's said to you in the first consultation. Ask the surgeon to give you a copy of the notes which have been made, take it home, discuss it. It's always good to bring somebody else along with you, because the two of you will absorb more than one person. Come back, have another consultation. But I think it's essential to make sure that you trust your surgeon, you feel comfortable with them, you feel that they're honest and transparent. And an honest and transparent surgeon, how do you know who they are? One, if they tell you what your objectives are unrealistic, don't be angry with them. They're being honest and they're trying to guide you in the right direction. Two, they need to tell you about the potential complications of the procedure that you're seeking, the rehabilitation and the longevity of what you're having done. And I think if all of these are put into a salad bowl, then hopefully it'll result in a good relationship and a good outcome.
Fantastic. Dr. Parry Mohanna and Mariam Brad, thank you ever so much for joining us today in today's show and having you, obviously, in today's show. But to end it, we did say the fact that the advice, the perfect advice would be from what Dr. Parry said about the fact that you've really got to go and see and find out about your surgeon before you actually go and even take that big, massive step of carrying out surgery. Thank you so much for joining us.
Thank you.
Vanity in our culture has increased and become more acceptable. People are more open about their desire to be attractive, and plastic surgery no longer has a negative connotation. Society has always valued beauty in literature. Attractiveness often symbolizes an admirable protagonist, while ugliness indicates the abominable antagonist. As children, we are taught, without even realizing it, to prize beauty. Our social network has created a generation that isn't fazed by images of blood, Botox or bandages. Sometimes during the process of beautifying average humans, they have implanted something besides silicone. The better that cosmetic surgery will improve lives, now not only do people accept plastic surgery, they embrace it as a solution to personal and professional problems. While appearance has always been important, mainstream acceptance of plastic surgery has created a society that values appearance over ability. I hope in today's show we have managed to touch on this very big and widespread topic. Thank you to my studio guests, Dr. Parinaz Mohanna and Maryam Rad. Thank you very much. And also for joining me, there was the telephone and Skype guests also for taking part. So I hope you can join me next time on Her Voice.